Over the past few videos, we've looked at some heavy topics around this subject of what to do when it feels like your marriage might be beyond repair. We also looked at the situation where marriage therapy might have failed you before and you're not sure if it makes sense to even go back. And then we also tackled some questions just around how to even have the conversation about getting help. So getting your spouse, inviting your spouse into therapy with you.
And we know that this brings up a lot of valid fears and questions. So today we want to tackle 5 of the toughest, most common questions that we get from couples who are feeling very stuck in their relationship. So let's jump right in. Question number 1, Caleb. A lot of couples think their problems aren't bad enough for therapy. They see the 4 horsemen, but it's not happening every day. So how bad is bad enough for therapy? How do they know when to go to therapy?
Yeah, that's a great question. And, from our side, we would always like to see people come sooner rather than later. So if it's enough that you're listening to this video, then maybe it's worth considering whether you are in a position now to look at this. But just to give you some ideas of how to approach this, you don't have to be in a full-blown crisis with each other where somebody is looking at packing a bag or it's getting really, really quite serious in that sense. But a better question maybe to ask yourself is, are we getting stuck? Or even are we getting stuck quite a bit on this one topic or on several topics even, where we just can't seem to resolve stuff and repair things after we've had conflict?
Yeah.
That's a good indication that this would be a great time to get into therapy, to figure out what that cycle is that we've talked about in some of these past videos, and to see how you might be able to get some help.
It's the longer you wait, the more entrenched in your cycle becomes.
Yes.
I think you said that. So sooner rather than later is good.
Is good. And we also, to pull in some of the threads, getting into it before you're getting, into contempt with each other because you can't sort this thing out with the other person. So you're getting frustrated, annoyed, starting to get disgusted with them.
Yeah.
You want to come in before that. Think about if you can treat it like a checkup, the general practitioner visit to the doctor for what you need.
Right.
Instead of waiting until you're pretty certain that you're going to have to see a specialist or get surgery.
Yeah.
Come while it's more treatable.
Yes. Yeah.
It's always better. The longer you wait, the more entrenched you become, as I've said.
Yeah.
Yeah.
And normalize therapy is part of our mission.
Yes.
And to help the world understand that everyone can benefit from therapy.
Yes.
And you don't have to wait for a crisis.
Yes.
But it's how can we make this better even?
Yeah. It doesn't mean your marriage is bad because you're coming for therapy.
Yes.
And it just means that you really care about it and it's important to you.
Yes. Oh, I like that.
Thank you.
Yeah, that's good.
Yeah. So that's one common question we get, how bad is bad enough for couples therapy? But another question we get, Verlinda, is what if my partner still refuses to go? We talked about this a little bit in the last one. It's a tough one that we hear a lot. Maybe someone listened to our last video. They were vulnerable. They found the right time. They found the right words, but their spouse still says, no, I'm not going.
Yeah.
What can they do then? Is their marriage now doomed because they're not going?
No, absolutely not.
Feel like it.
It can feel like it in the moment, especially when you've made yourself vulnerable and you still got what feels like a rejection in that moment. But I think the single most effective thing you could do was get help yourself. Go to therapy yourself, work on yourself. Because it's kind of like the teeter-totter thing, right? If I move, my spouse has to move and do something different.
Yeah.
And so if I go to therapy myself and learn how to do things differently, learn what's going on for me, then that will make an impact. And it could be that your spouse is going to be at first they might not like the changes because it's something different, but they'll begin to notice them.
Yeah. They seem more peaceful or they just seem more relaxed and maybe I could benefit.
Yeah.
We've had that happen.
Or it could be they're not willing to put up with my BS anymore.
Yes. And you're kind of left acting like the only person in the room who's
misbehaving. Yeah. Yeah.
Yep. So that can happen. Talk to me too, Verlinda, a little bit. Sometimes it's just a matter of timing as well.
Yes. We talked in the last one about putting a pebble in the shoe, right?
Yes.
Sometimes it's just not the right time. Sometimes it's been stressful and they can't wrap their head around it. But you've planted the seed. You've planted the idea. And it could be that over time it will grow.
Yeah.
And they might come back. It could be too that it's a matter of setting a boundary.
Yeah.
Of this is something I need because I can't live in this anymore.
Yes.
I want what I want what I want, whatever it is you want, you can say that.
Yeah, if your spouse wants something from you in the relationship, it's okay to say, in order to give you that, I think I will need to have someone in the room where we can talk through some of these things.
Yes. Yes.
Which is a way of saying a boundary, because it's stating the loving terms in which you're willing to engage with them.
Yeah.
Yeah.
That's good.
Yeah. So a refusal doesn't mean it's always going to be a refusal. You can work on yourself. There is the option of boundaries. There is just timing. Sometimes just waiting can help. So those are all good things. Yeah.
Yeah. Third question. And this is a fear that is very real for people, because I've had people tell me this. What if the therapist tells us to break up?
Yeah. So a good therapist will never tell you to break up.
A good ethical therapist. Yeah.
Yeah.
Yes.
Yeah.
Amen. Agreed.
Yeah. In an abusive situation, a good ethical therapist will help the abused partner find or create an escape plan leading to separation.
Not in couples counseling.
Not in couples counseling.
Yes.
Yeah. But yeah, a couples counselor, when it's just about conflict, should never tell you to break up and should never tell you that you have to stay together.
Yes.
And should never use God. Like, we're Christians and we do therapy. And this is a little fresh for us because it happened to a friend, but like, Bible thumping and say, well, what does God think? You have to stay married is just not appropriate from a good, ethical couples counselor.
Yes.
Even though they may hold the value of trying to save marriages or being biased towards saving marriages, you have to make that choice on your own.
Yeah. As a therapist, we don't live with the consequences of that decision.
No.
You live with that the consequence of that decision every day, every minute of every day.
To stay or go.
To stay or go. So we cannot make that decision or tell you which way to go.
Yeah. So I'm not going to tell you outright that you should fire that therapist, but that would it's a red flag if the therapist does tell you that.
Yeah.
There are situations where we recommend therapeutic separation, like I referred to in cases of domestic violence, in severe betrayal, those kinds of things. And even then, though, our hope is that both people would do all the work that they need to do to be able to come back to the marriage or to the reuniting as a safe partner for the other person.
Right.
If you are married to someone who has quite a history of domestic violence, that is going to be a lot of work, and it's going to take quite a bit of time for them to do that. And they're going to have to be very committed to the treatment that they engage in. And the success rates are not as high as we would hope for that. But again,
safety.
Your therapist should not be the next controlling person in your life after you've just got away from one controlling person. So they shouldn't be telling you what to do. So hopefully that just gives you an idea of like how to evaluate what you're being told.
Yeah.
Yeah, good question.
Yeah.
Verlinda, what does a first EFT session look like? So we've talked about that and how great that is. We're obviously big fans. We see good results.
Yeah.
And can you just demystify what the start of that is going to look like? And I'm just going to hold out for my bros here for a sec, for the guys of the world who are, they hear emotion focused therapy and they're like, oh yeah. Like, could we do something with a spreadsheet? Could we do something with facts?
And
they're like, emotions, haha. I'm not an emotional guy.
Yes. Well, I would say the first session is all about like building safety and understanding your cycle. No, I'm not going to say understanding
safety. Like, just help me with that.
So in the room, I'm going to interject, or I'm going to structure things so that one person isn't getting attacked by the other.
Okay. Are you going to try to make me cry?
Not in the first session. I never try to make...
Yeah.
Well, I can't say never.
You do help people get in touch with their more soft or negative emotions.
Yes, because it's such a beautiful thing.
Yes.
When someone who's only showed like anger or loud or whatever can be like, I was so scared.
Yes.
Right? And that often will bring tears. Yeah. But in the first session, it's like creating some safety, creating a few like ground rules. Yeah. Sometimes if things are getting pretty heated, understanding your story.
Yes.
Like yeah. What happens between you guys? Yeah. What brought you here? What do you hope to get from this?
Yes.
Like if this was successful, what would it look like to you? because to different people, it might look different. So often the first session I would do together, and then often I would have separate sessions for each of them just so they can let down their guard and kind of
talk to you without worrying about how it's going to land on the other person.
And get more their attachment history, their family of origin history, that kind of thing, and then come back together again.
Yeah, and I think I want to say too, like there's consent through all of this process, right? So
yeah,
if I have trouble speaking about an emotion or I feel like it's too much, then we explore that rather than still trying to hammer into that emotion.
Yes.
So what comes up for you when like you start to feel a sadness and then you push it down instead of just like, here's a Kleenex, I need you to cry.
Right. Yeah.
So it's a very gentle and understanding and compassionate and patient process.
Yes.
Nobody gets
We're not forcing anything.
Forced.
Yeah. Yeah.
Yeah. Good.
And even safety for self, like when the big emotions do come up, it's a safe enough place that I can say what they are, or I can say I don't want to feel them, or whatever.
And part of the wisdom of your approach too is you're matching like the vulnerability to where they're at in the stages of therapy.
Mm-hmm.
So the really tender conversations happen when it's de-escalated.
Yes.
And they're safe with each other and they know how to hold that for each other.
Yeah. So those tender conversations are not generally happening in the first session.
No. Yeah.
But hopefully that first session feels safe and often couples talk about like when there's a third person in the room, they're much better behaved than when it's just the two of us having at her.
So it gets productive right away, but it's you layer into it.
Mm-hmm. Yeah.
I think that makes it seem more approachable.
Okay.
Linda?
One more thing. I realize I'm going on a little bit here, but it's not about blame. Like I am not looking in that first session to be like, okay, is he the problem? Is she the problem? Who's actually the problem here? It's like, no, I honestly believe with all my heart that neither one of you are to blame. Neither one of you are the problem. It is the cycle that happens between you that is the problem that you're stuck on.
Yeah. Love it.
Yeah.
Such a good approach.
Question 5. Is it too late if we've grown too far apart? Like, what about that couple who feels they don't have any shared values anymore, or like we're strangers that have gone in two completely different directions? Is it too late?
Yeah. So feeling like strangers, like, can be such a worrying and painful part of the disconnection that can come into marriages, for sure, or coupleships when they've been going for a while. And that part of their connection has just faded or eroded or whatever. It's a valid concern. It's not a fatal diagnosis.
Yes. Yes.
It's a valid concern. Please get into therapy. It's not fatal. Okay? Responds well to treatment. Is what I would say there. And often when we see these couples, we're able to get to and find that there's still deeper shared values, shared goals, shared vision.
Even if we don't feel them on the surface day to day.
There's still like the happy recollection of the things that they started with when they can go back to those spots. And maybe you've grown apart. Maybe you aren't the team that you once were, but when all the conflict noise gets turned down, there's much more in common than maybe you realize that's still operating with you guys. Like you still have these shared things that you're doing. Like you want your kids to have parents together or to have, you know, chances for university and growth and church or whatever is important for you guys. Right. So a lot of that good stuff. And as I was sort of thinking about this question, like one way to reframe this is actually to think about it this way. Like if you guys have grown apart and you know that you fell in love maybe many years ago, but now you've grown apart, this is actually like an opportunity to fall in love again and rediscover a bunch of things about each other, which is like the basis of what it means to fall in love. And so like there's a huge growth opportunity here that you guys can bring yourselves into, even though it feels scary and maybe you've tried to reconnect and the ways that you've tried have not really worked well for each other or for you guys together. There's still like a beautiful opportunity here with the right facilitation. Yeah,
that's beautiful. And we might have to process some hurt and find healing before we can like move forward, but the opportunity's there.
Yeah. Maybe there's moments you really missed each other and those kind of defined some of the protective things that you're doing right now. But we can sort through that with you. Yeah. Yeah. It's good.
Yeah.
Does that kind of answer that? Is it too late if you're drawn too far apart? I mean, there's always more growth in humans. That's
Absolutely.
the take
Yeah.
that we had.
Yeah. And I think such a beautiful thing what you just said again. It's like, maybe you have grown so far apart, but this is also, you can make a choice to go your separate ways, or you can make a choice to grow together. Rediscover each other.
Yeah.
Yeah.
Yeah. That's so good. Yeah. So hopefully answering some of these questions has reduced some of the fears around this, brought some clarity for you.
Yeah. And every question that you have is valid. And the best way to get like personalized answers for your specific questions is to book a 20-minute consultation call. You can do that at therapivo.com. Find the couples counseling page, ask your questions, tell a little bit of your story, and find a therapist that works for you.
Check us out at therapivo.com.